Let's talk about a mallet finger injury. I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. Mallet finger injuries are fairly common. Last week I talked about jersey finger injuries, and that's really not that common. But mallet finger injuries are pretty common in sports that involve balls and other objects flying through the air. Basically what happens is the ball strikes you on the end of the finger, sort of traumatically forcing it down and rupturing or tearing or pulling off the tendon that extends, that basically is out to the tip of the back of your finger. It's the tendon that helps you straighten out your finger. So then you basically see this finger that's sort of bent down like that. You think you just sprained it, you didn't basically break anything, and you leave it alone, but then all of a sudden, weeks later, you realize you can't straighten your finger all that, that far out, or really at all. So I would tell you it's worth getting it seen, probably by a hand surgeon would be best, right away after that injury occurs. Fortunately, most of the time, you can treat it by wearing this splint that keeps the tip of your finger fully straight. Now you have to wear that splint usually 6 weeks, sometimes 8 weeks, and not take it off, because if you bend the finger during that time, breaks up the healing tissue, you end up starting all over again. Sometimes when you pull off that tendon, you also pull a piece of bone off, and so occasionally that needs surgery to basically pin that piece of bone in the right position. But most mallet finger injuries don't need surgery. Now, if it's been something that happened a long time ago, and now your finger is kind of bent down like that, you can't straighten it out, and it's been months or years, maybe there's a surgery to treat it, but it's going to be a much, much bigger surgery. So ideally, if you suffer an injury, even if you think it's a sprain, but you can't straighten the tip of your finger, go to a hand surgeon and get it checked out. Have you suffered a mallet injury, and how did your doctor or how did your surgeon treat it? Was it just a splint? Did he or she tell you need surgery? I'd love to hear your experience. So in the comments below this video, describe how it happened. Describe what treatment options were given to you and how you got over it. I can't give you specific medical advice in the comments, so probably won't respond to you, but I do read those and I would love to hear it. Maybe I'll answer it in an upcoming Ask Dr. Geyer video, but definitely share your experience so we can all learn from what you went through. Now, I'd also love to hear the biggest injury challenge you're facing, whether it's a mallet finger or some other injury. I know there's frustrations that people go through. I'd love to hear them. So in the description below this video, the very top link, if you click on it, it'll take you to a page where you can write tons of information about exactly what you're dealing with. That information really helps me create videos that are helpful to you, or maybe courses or programs, because at the end of the day, I want to help you. So leave as much information as you feel comfortable. Now, if you like videos like this and you want more information on sports and exercise, injuries, injury treatments, injury prevention, subscribe to my video channel. Click the subscribe button in the upper right corner of the page. I record several of these videos every single week. They'll get delivered directly to you. Thank you so much for watching. Really hope this was helpful. If you know somebody dealing with a mallet finger injury, please share this video with him or with her, and I look forward to seeing you right here next time.